Hello, and welcome to another episode of The Becoming Show. Today, I'm so excited to have my brother back on the English channel. And today, Dr. Chanh Vo, he's going to talk about the dental health. But we're going to go beyond the basics of dental health. And as you know, last time when I introduced my brother, I ask him the advices for the laziest person possible because I'm one of them. I don't like to floss 3 times a day after every meal. So I ask him for all the basics. What's the minimum that we should do? And today we're going to go beyond the basics. Welcome to the show, Anjan.
Thanks for having me.
Okay, so
Hello,
first of
everyone.
all, yes, and first of all, I wanted to preface with even though this show it's gonna be about dental health, but we're gonna go. We all know that our oral health, our mouth shows a lot more symptoms than just the dental problems. It goes way beyond just the teeth. So can you just maybe share a little bit of what how important our mouth, our health in the mouth is to relate it to all our body health?
Right. So the mouth is part of the body, right? It's not a separate entity. So what's going on in the mouth can easily be transmitted to the rest of the body through the blood system, right? So if you have lots of bacteria in the gum, it can go into your blood and then it travel everywhere, even to your brain, to your heart, causing all kinds of issues, right? So make sure that you have good oral health, not just because for good teeth, it's for your overall health, because it's part of your your body. Don't forget that.
But you know what? When you see your patients and when you do the annual checkup and the 6 months, we call it renewal exam and stuff like that, is there something that you watch out for when you look at their mouth, just to warn them of things that they should be going and have a checkup for?
So gum disease and periodontal disease are the biggest one because they have lots of bacteria in the pockets around the teeth, and then these bacteria, they can go to your blood, and then it go everywhere, through the rest of your body. So that's what you know it's more important than cavity, because cavity is just more like localized to the teeth.
Mm.
But the gum and the bone around the teeth, it's direct link to the circulatory system, right? So that's so important.
Wow. So you mean the gum conditions, the gum health is actually even more important than the teeth itself, like the cavities and stuff. It's
Right. So
fixable.
if you have a cavity, you have only that tooth is affected. But if you have the gum and the bone supporting that tooth is unhealthy, full of bacteria, then you have a much bigger problem than
I
the
see.
than the cavity.
So that's
So
why it's important to actually have your teeth cleaned every 6 months or so to make sure that your gum doesn't bleed when you brush and make sure your gum is
right, like if you have good oral hygiene, you you brush, you floss properly every day. It should be it should be in good health, and then maybe once a year, just get a cleaning. Make sure no residual is left.
healthy. But you know what though? I noticed that brushing alone is not enough to keep your gum healthy. And so flossing is actually the very important to keeping your gum healthy, correct? The
That's
floss.
right, because flossing clean between the teeth. The brush cannot, do that. So when you go and floss, it go between the teeth, and then you go down into the gum as well. Not just the teeth, right? So you go to the bottom of the gum, all the way down. and then up. And then do that a few times on both sides. Like each area that's the left and right, both sides. So you make sure both sides are taken care of all the way down and then up. Make
Okay.
sure make sure it's all the way down to the gum, not
Okay.
just touching the gum, but to the bottom of the gum. Not
So,
too hard. Just make sure you can feel it when you touch the bottom of the gum.
mhm. And
Yeah.
if you see any blood coming out, and when you brush your teeth or when you floss, is that a big red flag to come see a dentist right away, or can you just take care of it at home?
Well, mostly, unless you just scratch your gum, But if you brush and then there's blood, lots of blood coming out, that's not a good sign.
Mm,
Even when you floss, there should be no blood. If the gum is healthy, there should be no blood at all. Even though you go all the way down to the gum,
okay.
to the we call it the sulcus, uh, you know, and then you go up and down. There should be no bleeding at all. If
Okay.
it's bleeding, that means there is gum disease going on.
S-
So and you can feel it, like it should be smooth with the floss, and if it's catchy, you feel like it's catchy. That means there's calculus along the root,
Uh-huh.
and so you need to get it clean out.
So if it's bleeding, which is something that we can see, it's easy to see and catch that. That means
Yeah,
we need to treat it where the dentist will be working on the gum, removing all the calculus and all that, up to the point where the gum becomes healthy and pink and not bleeding again. Is that our goal?
yeah. There should be pink gum, no bleeding anywhere.
Okay.
There should be no bleeding anywhere. And if you do that every day, that's how it's maintained.
Okay.
But if you slack off, then you will notice the bleeding right away because all the plaque from the previous day will do the damage.
so
Bacteria will feed on that.
so you know what? Let's do the minimum requirement for someone who's lazy. The minimum requirement is how many times brushing a day and how many times flossing a day.
you
So let's
know,
talk ideal. Let's talk ideal and let's talk minimum.
minimum. Okay, so it can change a bit from person to person, but let's say once a day at night before going to bed, brushing, and flossing maybe 3 times a week, also before bedtime.
Okay.
That's the absolute minimum. I
And
mean,
before
ideally, I
bedtime,
would
is it
like
because of the
flossing
during the
and,
night? Is it because during the night the saliva and all the bacteria builds up? That's why you want it to do.
well, because if you, let's say you brush and floss in the morning and that's it, and then you eat during the day and then you go to bed, no brushing, no flossing. So all those food, debris, plaque will sit there around your teeth. And then the whole night they are there as a food source for the bacteria. And
Ah,
then they feed on them and then they do all the
damage.
bad things. Yeah. So
Okay.
you want to get rid of the fuel, the
Yeah.
food source for these bacteria,
Okay.
right?
Right. So
That
if
at 8 hours or 9 hours overnight, that's a long period. Plus, you have less saliva during the night, so it's a heaven for those bacteria with all these food sitting around, right?
wow. Okay.
Yeah.
Okay. And then in terms of the ideal cases where someone who's like OCD on brushing and flossing, what does it look like?
So you're talking about somebody who brushes after every meal, kind of
Okay.
thing.
Yeah. Okay.
That
Every
that's
meal.
that's ideal. If
Okay.
you can do that,
Yeah.
that would be awesome. but
Yeah.
I see very few people doing that. I
I
can
know,
count on
right?
my finger.
So morning and nighttime is, well, or at least once a night. But usually people go to work in the morning, so they do brush too. Oh, one question in terms of when to use the mouthwash. Do you even recommend using the mouthwash?
I don't know of any mouthwash that is not um, antimicrobial, like on a broad spectrum basis, meaning they kill everything. Okay, and we don't want that because we have good bacteria, well, harmful bacteria and beneficial bacteria in the mouth, and we want the good guys, right? We don't want to kill them. So these mouthwash, they are broad spectrum kind of antimicrobial. So they kill everything, including the good guys. So I just use them as a short term, 1 to 2 weeks only,
Okay.
not long term.
Okay.
If you do that, you're gonna kill all the good guys, and then you lead to resistant bacteria, which mostly are the bad guys, and then you end up with mostly the bad guys, in the mouth, and it's not good.
I'm curious though, because usually when we talk about good bacteria and bad bacteria, I usually think of in the guts, not in the mouth. So,
Well, the mouth, believe it or not, the mouth is part of the digestive system. The
ah,
digestive system starts in the mouth, and then it go all the way down to your anus. Okay.
okay.
Yeah. So the
Okay.
mouth is the starting point for your whole digestive system.
Right, right.
It-
That
Don't
makes
think
sense.
don't think of it as a separate.
Right, right, right. Okay. So let's move beyond just the basic of dental health here. Let's because most people when they think of dental health, they are actually not very fond of dentists, to be honest, because they're afraid of needles. It's painful when they get poked, and of course it's scary when, and even the smell of a dentist office isn't the best smell, because all of that yeah, the alcohol smell and all that stuff. So usually people go to a dentist to fix a problem or to prevent a problem, but they don't want to come there unless there's a few cosmetic procedures, for example braces, or now implants or veneers where they look good. And the reason why people want to do these things is because they want to smile, they want to have a white teeth, a better smile, and all that stuff. But I remember when I was like when I first started working in your office, I remember you said something like people don't need teeth. They don't need teeth. They don't need to look good. This is just a choice. This is all a personal choice. But can you please share why you don't advise people to damage their teeth for the sake of looking good? For example, when it comes to veneers or teeth whitening or anything like that. Like, can you share what you think? Because some of the things that people do when it comes to making money is they try to do all these kind of cosmetic procedures when maybe it's not the best thing for them for their health. Please share
it,
honestly
it,
about how
it-
you think about these things.
when it comes to aesthetic, it's so personal, right? People get breast implants, they do facelifts,
Yeah,
and who are we to judge them, right?
right.
So if they come to you and they say, "I want white teeth, I want good looking teeth, I want straight teeth," it's legitimate. There's nothing. I cannot say it's wrong. You know, Even though, let's say, somebody who has straight teeth but uh, kind of browny or gray, and then they want white. So that's that's not wrong on their part. They want to feel confident, right, when they smile.
Yeah,
But then I'll have to explain to them um, the the trade-off. There's always you gain something and then you lose something. So if you do, let's say, veneers to make them wider, basically you have to take away a thin layer of the teeth, and then you put on the ceramic in front of it. So you take away something that is uh, nothing wrong with them. It's still healthy. Uh, doesn't it just doesn't look as white as you would like it to be,
Yeah.
but it's healthy otherwise. So
Yeah.
you grind it away, and then you put the ceramic materials on. Uh, it cannot be the same as the original teeth in terms of structure, right?
Hmm.
So you always in down the road there's always issues of the ceramic falling off, or you might get decay around these ceramics, and then you have to redo them after some time. And if they you just have to explain to them the you know all the consequences of doing that procedure
Yeah.
down the road. And they once they are informed, and then they think they still want to go ahead, then you go ahead, as long as they are informed, basically.
Right.
Yeah,
How
they
long
have
do
to
they take?
know they have to know the pros and cons
Yeah. And the
fully.
cons of it is that you have to keep replacing them every what, 10 years, 20 years? How long do they last?
Hard to say, depending on how they use and how well the these veneers or crowns are made.
Mm.
If it's made good, no good fitting, no leakage, like perfect fit, and if the patient don't have any parafunctional habits like grinding too much at night, that could be 15, 20 years,
Mm.
you know. But eventually these material can chip and break and stuff.
Yeah. So then
And
it's
even,
just you just replace it with a new veneers then, correct?
right, yeah.
But functionally, like in terms of functionally in terms of comparing to the real teeth, like to enjoy food and chewing and all that stuff, how much percentage do we lose in terms of functionality? 20%
No,
or
no, for the veneers and crowns, you don't lose any functions. If it's done properly, you don't lose any function.
okay.
You can chew perfectly fine, even better than original if the occlusion wasn't correct in the beginning. You can correct them with these you know uh, crowns or veneers or bridges. Yeah.
Okay. Then okay, I think I was thinking of the implants because I remember you said with the implants, because these teeth are not real, so you may not feel it. You may not feel the as you
Right. For
bite
the
into it.
implant, yeah, implant is a different story.
Right.
You with implants, you don't have the nerve, you don't have the periodontal ligament
Yeah.
around the root
Yeah.
of a natural tooth.
Yeah.
So when you eat something that is crunchy or kind of um, you know like toffee kind of food, you feel less, you have less sensations out of it.
Right.
Most people they couldn't care less, but for some they say that I feel less with my chewing than with my natural tooth, and
Yeah.
that's very accurate.
Right.
You
Right.
you have less sensation. Yeah.
And then with implants, now that we have implants, a lot of people were before implants, dentures were our only options, or crown or bridges, but it's so expensive. And now implants are much more affordable as well. But when it comes to dentures, for example, when do you feel that people should they, if they can afford it, is it just better to do implants or
Of course,
crowns and bridges?
Yeah, that's the next closest thing to natural teeth.
Yeah.
You eat, pretty much just like a natural tooth.
Okay.
It's very strong. You just have a little bit less sensations out of it. It's
Okay.
like it's like feel like a post that has like in a cement in concrete is it's so strong, but then it's not like a tooth where you feel the force of you chewing on something crunchy or
Okay.
you know, but it's you can chew perfectly fine anything you want.
Okay.
Unlike dentures, it's move around and the force is much less, and you cannot chew, you know, tough tough food.
Right. So
Yeah.
then nowadays with implants, I guess it's better to just have one implant instead of doing a bridge like before, where we have to like
Right. So
damage it.
let's say you miss one tooth.
Yeah.
Traditionally, in the past, you do a bridge, so you crown the two adjacent teeth, and then you make a three-unit bridge to with a thick tooth in the middle,
Yeah.
right?
Yeah.
So that becomes your typical conventional bridge.
Yeah.
But you basically have to grind down the two perfect teeth for that procedure.
Yeah.
So people don't like that. They want to keep the original teeth.
Yeah.
So they just do one implant for that missing tooth.
Yeah.
And yeah, it makes more sense like that.
Right.
But sometimes when they have no bone in that area and then they have to do bone graft, then it becomes more complicated.
Mm.
So some people choose to go to the bridge option. So depending on the case,
Ah,
they always have options here and there.
I
If
see.
they so against the bridge, then they do the bone graft and then the implant.
Ah. And then with the implant, if the bone isn't that great, actually, you know what? Let's back up a little bit because I remember you said that we were born with what 32 teeth, right? Or
Yep.
a full set of teeth is 32 teeth, and we should die with 32 teeth, technically.
Well, no, the wisdom teeth are usually removed if they are problematic
Ah,
because it's too tight back there. Then just remove them. A lot of times they cause pain, so infection and stuff. So we remove those four wisdom teeth, and then you have 28 left.
okay.
So and then if you do braces, they might take out some more.
I know, because I had braces. I lost what 4K 9s
No, not canine, premolar.
or
It's like
premolar. Okay.
yeah, behind your canine. Yeah.
Yeah, yeah. So, okay, so then technically we're supposed to retain all of these teeth on the day that we die if we take care of our gums and our teeth
Of
well.
course, yeah. If you do good oral hygiene every day for the rest of your life, then you should have them until
Wow.
until you die. Yeah,
Oh my.
unless you have some special genetic condition that destroy your teeth so easy so early, or you lose teeth so early. But those are very rare,
Hmm.
so we don't worry about that.
Is it more likely that people get cavities than gum disease? Which one is more likely?
The cavities is more likely to happen, more common than gum disease. Gum disease usually for the adults when they are in their 30s and later. But kids usually most of the time they don't have gum disease, but they have cavities.
Okay.
Yeah, but adults also can have cavities too. So yeah, cavities is more likely to happen.
Oh, I
Yeah.
see. Interesting. I thought it was the other way around because I thought that in order to have a cavity, like that that bacteria has to dig in, has to really stay there for a long, long time. Whereas the gum, I don't know. I just thought that it might be easier to have gum conditions, gum diseases than cavities. Okay. And then, so once you get a cavity, um, and once you actually felt the pain, is it already usually too late and it
That's
requires
right. Yeah.
a root
So
canal?
a cavity will start from the outside of the tooth, right, and then gradually get bigger, bigger until it reached the nerve,
Yeah.
and until it reached the nerve, you don't feel it. You
Oh,
don't know. By the time you feel something, it's already into the nerve, and then it's too late. And then
uh,
you need root canal and stuff,
right. Which
which
means
is
more
totally
expensive.
yeah, totally unavoidable.
Yeah.
Totally avoidable. Sorry.
Oh, yeah,
You
yeah.
know, root canal is totally avoidable if you know the cavities early, then you just do a filling. You know,
Right.
yeah. Don't wait till there's pain. That's too late.
So that means you need to have a checkup or the X-rays done every what? 6 months? Every year? Is every year enough?
Maybe say once a year is okay.
Once a
Once
year
a
is
year.
okay. Okay, speaking of fillings, I don't know about nowadays because I know myself, I wanted to have porcelain fillings because it looks better. It looks like there's no filling. Whereas if I have silver or amalgam fillings, it looks bad. What are your thoughts on that nowadays? Is a porcelain
Nowadays, amalgam filling is kind of phasing out.
okay?
Most dentists, I think, they they don't do amalgam fillings anymore. I
Mm,
think the majority stopped doing that now.
I
They
see.
do the composite fillings, which is what tooth color.
Yeah,
That's the most common now. I'm sure some dentists still do amalgam, but it's phasing out
yeah.
because of mercury in the amalgam, and patients they don't like the look of it.
Yeah. Oh, just 1 second here. Um, in terms of when it comes to health, well, dental care, I
Hmm.
know that sometimes you prescribe for us the what do you call those things for either for stopping the grinding or also to stop mouth
Yeah,
breathing.
just basically it's a night guard. It's an appliance that you wear when you sleep. You wear the whole night, so it's protect your teeth. So people who grinds a lot during the night, then you see a lot of wear on their teeth. So you can have these appliance, you know, but there are a few different types. You can just the appliance can be just protecting the teeth, or the appliance can be uh, used for opening your airway more, which is one of the big reasons for why you grind your teeth in the first place.
Oh,
So you have to understand why you grind your teeth at night. There are many reasons. Stress, anxiety could be one, but sleep apnea is another big one. Basically, when your airway is collapsed during the night, meaning the airflow is obstructed, right? So not enough oxygen is going to your lung, and then your brain will detect that low oxygen level, and it will kind of stimulate your jaw muscle to to act, to grind, to move. So basically, your lower jaw move around a bit when you grind, So that will open up your airway just a
Mm,
bit, just to improve the airflow a little bit, because every little bit help. The brain is so scared of lack of oxygen, right? So it wants you to do something to
yeah,
open up the airway.
right.
So that's why you grind your teeth. So if those are the case, then you need to open up the airway during your sleep. So you should go to a doctor, get it checked out, get a machine at home to measure your oxygen level. And then if it's actually a sleep apnea problem, then depending on the severity, you may need a CPAP machine.
Mm,
Or if you're lucky, it's less so, it may be moderate or mild, then you can have a dental appliance. You can wear it. It positions your jaw forward a little bit during your sleep. So when your jaw is forward in in front more than it's normally positioned, then the airway is open up more.
mm,
So then you kind of maintain your airway during your sleep like that. If it's a mild to moderate case, but if it's so severe, then yeah, the CPAP or other procedures would be needed. But
right,
you need to go to a doctor for the definitive diagnosis.
right. And I remember you also said that wearing that appliance will also help with reducing snoring.
Oh
Uh,
yeah, yeah. Snoring is a big sign of sleep apnea because the tissue in the throat is in the way. So when the airflow passing through, it kind of vibrate these tissue, and that's creating the snoring, right?
yeah.
So these flabby kind of tissue is it's not it's too flabby basically, and it's in the way.
Yeah.
So that's why the airway is partially obstructed. So if somebody snoring, they should go check out the sleep apnea as well.
Oh, oh,
Get it assessed.
yeah.
Yeah, sleep apnea is a very dangerous condition because it will lead to poor sleep. You cannot have deep sleep with this condition, and then poor sleep will lead to a whole host of issues for your health. Sleep is the one of the pillar, the foundations of health. So poor sleep, even though you have, let's say, 8 hours, you seem to be getting the duration okay, but the quality is not there.
Mm.
Then it's not enough.
So if people have snoring partners,
Yeah,
send them to do a sleeping test and see if they need a CPAP machine or just this dental appliance to help them with
yeah. So these dental appliance will for sure help with the snoring.
yeah.
Some people may not have sleep apnea yet, but they just have a big snoring issue, and then they can
I
wear this, and then yeah, the snoring will be a lot less, more tolerable.
I know because I'm a snorer too. But you know what? The problem with us snorers is we don't know if it makes any changes. We have to depend on our partners to tell us if
Yeah,
it helps at all.
yeah. Well, you can record yourself. It's easy enough.
Oh, that's
No,
right.
but
Yes, yes.
but the partner is the easiest way to tell, right?
Yeah.
Yeah.
And then one
So
more
it's all
thing.
about the airway. If the airway is obstructed, then yeah.
Right. And I remember you also say mouth breathing is actually not good for us when we
Oh, of course, yeah. Mouth breathing. Why it's bad? Because your mouth would be so dry, and then it's not good for your gum, not good for your teeth. You want a wet mouth because saliva is so. important for your oral health.
Mm.
For cavity prevention and gum health, you need saliva. So when you mouth breathe, it's definitely no good for the mouth. But then the bigger issue is your overall health, because air is supposed to go through your nose and then through your sinus. It and then basically it's precondition for the lung, and then you get more oxygen. You get better um, oxygen exchange when the air is going through your nose and your sinus instead of through your mouth and then down right away. It's supposed to go through your nose first, your
Mm.
nose, your sinus.
Yeah.
Those are the structures that kind of condition the air before it enters your lung. Okay,
Right.
so not just good for your mouth, your teeth, but for your overall health. You have to breathe through your nose, definitely.
Mm.
And a lot of people, when they wake up in the morning and they feel like my mouth is so dry, then that's a big sign that they breathe through the mouth. For some reason, they just open the mouth and they breathe through the mouth unconsciously.
Yeah.
So one easy way is tape your mouth. Maybe get some kind of mask, like duct tape or something. Tape your mouth, and then see if you can sleep with that.
Ah.
And if you can't, you may have some kind of blockage in your nose. So get it checked out.
Mm.
Your nose has to be clear. Sometimes you may have an actual blockage, and then you're forced to breathe through your mouth.
Yeah.
But those are not common. Usually, it's a habit.
Okay.
So then you may just tape your mouth, or you may wear an appliance to close to seal the mouth, forcing you to breathe through the nose. And the same appliance that treats snoring and sleep apnea can do that job.
Yeah.
It it force it forces you to breathe through the nose.
Yeah.
Yeah.
One more thing that a lot of people do when it comes to their teeth is braces, and I don't know if other people have this problem or not. But when I got my braces, before braces, I didn't have any clicking. I didn't have any jaw popping or clicking. But after I got my braces, I have that problem. Can you just talk about braces, the benefits, and maybe the cons, if there's any?
Well, braces, basically it's the biggest purpose is to correct malocclusion. So if you have malocclusion is how the teeth um, bite together,
Ah.
and it's not in the right way, and then we call it malocclusion.
Okay.
So braces will fix that,
Yeah.
and then it can fix um, crowded teeth, or like minor um, aesthetic kind of problem. But the biggest the biggest reason for braces is to treat the malocclusion. If you have um normal um, TMJ, meaning these two joints here
Yeah.
before the braces, and then after braces you have these clicking, it could be a coincidence, meaning you're gonna get it anyway with or without the braces.
Oh.
Okay? Because the braces is supposed to improve your occlusion, meaning the way your teeth come together when you bite.
Ah.
Uh, there might be cases where they make it worse off, but I don't think it's very common. It's rare,
Oh.
because you have, for your case, you have a malocclusion because you don't have a canine in the correct position,
Yeah.
and they fixed that. So it should improve your occlusion rather than worsen it. Now the clicking could be it could be there anyway, with or without your braces.
So,
So
so you mean we can change? The TMJ can develop later on as part of.
TM TMJ is always there. TMJ is the joint. But when
Ah,
we talking about TMD, meaning the disorder of these joints,
okay.
then yeah, TMD can develop later on. Yeah.
Really?
Yeah.
How? Is it because of how we sleep at night, how we grind our teeth, or what?
Yeah, yeah. I mean, there's many reasons for the TMD, meaning
Mm,
temporomandibular disorder.
yeah.
The disorder of your TMJ is these two joints right here,
Okay.
okay,
Yeah.
right in front of your ears.
Yeah.
So if you have disorders of the TMJ, then you have clicking, you have pain when you eat, but usually it's a very chronic condition that it's ongoing for years and decades. Very rare cases where it's so acute that you cannot even eat, you cannot even open your mouth. It can happen, but
Mm.
those are very rare cases. I don't deal with that. I just refer to the oral surgeons for that.
Right.
Yeah,
Right.
but uh, when you grind your teeth so much every night, then yeah, it can damage these joints, right? So just like a knee joint, you when you abuse it in some way, you're gonna wear it down sooner.
Yeah.
Yeah,
I think we pretty
but
much.
TND or TNJ disorder is yeah, it's not my area. When I see that,
Yeah.
if they grind their teeth, then we'll we'll deal with that. And if they still have issue, like if they cannot eat or a lot of pain, then they go to the
Mm.
specialist.
Okay.
Yeah, but that's very rare.
Yeah.
Mainly, we wanna treat the grinding, the clenching. Those are bad habits that they need to get rid of.
I'm pretty sure I think I've asked a lot of questions about all the types of teeth problems and solutions. Is there anything that I should have asked but I haven't asked you yet about dental health?
Ah, well, let's see. You asked about um, veneer braces, implants. Um, yeah, let's say somebody who has a lot of periodontal issues, meaning they have bone loss around the teeth. Okay, uh, so they have kind of mobile teeth. It's still usable in in everyday life, but they cannot eat. You know, normally they don't enjoy food as much because of discomfort when they chew because of weak teeth. Mobile and pain.
Yeah.
Some small, a little bit of pain when they chew.
Yeah.
So those people, they have, we take X-ray and we see a lot of bone loss, and we see the life of these teeth maybe 5 years or less. Then maybe they should be thinking about dentures or implants. It's not healthy to hang on to those teeth because it's a source of big inflammation, infection,
Oh.
and then it spread to the rest of the body, right?
Oh.
Causing issues. So a lot of people they want to hang on to them, but it's it's in their interest to get rid of them if it's poor prognosis.
Oh.
They're not going to have it for a long time, less than 5 years. Then maybe just get them out and wear dentures or implants. then you get rid of these chronic inflammation and infections.
Right.
Better for the health. Yeah.
Is it still possible to get implants when their bone is already lost, like you said?
If they're lucky, they might have enough left. You know, it's yeah, it's usually more than half. They have they still have enough.
Oh.
But if not, then they can always wear dentures or get bone graft, right?
I feel like dentures is nobody's dream. Like,
No, but even but they hang on to these bad teeth and they cannot eat uh, properly anyway. They don't enjoy eating anyway,
yeah, yeah, that's true.
right?
Yeah,
So and then they have these source of infection always there in their mouth, meaning it's in their body. It's
right.
going everywhere through the blood.
You know,
But
there's one.
it's you can only advise, and then it's their decision.
Yeah, yeah.
Right?
Actually, I haven't asked you about whitening yet, teeth whitening.
Ah,
I know that some dental office offer like in-house teeth whitening where they go there for an hour, several sessions, and then get it done there. And then some send home with a like a home kit kind of thing. Do you recommend doing these things? And if yes, what do you recommend? What's the best?
well, these whitening thing, they don't harm your teeth. They don't damage your teeth if you do it the right way, as as recommended. So it's much better than doing veneers, or crowns to
Yeah,
whiten your teeth. Yeah, so definitely it takes more time. It's more kind of inconvenient, you know, but it's much less. It's not invasive. It doesn't damage, anything. So
yeah,
yeah, you that would be the the best way to do if you're okay with it. It's not instant result. It takes patience.
yeah,
You need to do it sometime even a year, depending on the severity of your discoloration.
right.
So
What about sensitive teeth? Like I think everyone has at some point when they grow older and when the gum becomes a bit more sensitive,
yeah,
the teeth sensitivity. What I mean is when I drink ice cold or when I eat ice cream, there's that sensitiveness. Uh,
mm,
can we fix that? Can we avoid that?
yeah, it's mostly to do with your hygiene every day, and if you brush. Some people I see they brush so hard, they use too much force, and then you have gum recession, and then you have abrasion of the teeth along the gum line, and then you have these sensitivity issues. So correct the your way of brushing. Gentle. You don't need to go hard. You do it every day. You brush very gentle, and then soft brush. That's how you do it. And then if you still have these sensitivity issue, then maybe use a toothpaste designed for that. They will be written something like for sensitive teeth, like Sensodyne or many other ones.
Yeah,
You can use these, but main thing is I think to do with your way of brushing, and your grinding can contribute to this as well. When you grind your teeth, you will break away uh, tooth structure along the gum line, creating these grooves along the gum line, and then it will cause sensitivities.
mm.
So grinding of the teeth, and then wrong way of brushing. Yeah, make sure you avoid that.
Do you think? brushing your teeth or rinsing with salt water will help with that sensitivity, or help
Yeah,
with your gum line, gum
yeah.
bleeding?
Rinsing with salt water can help for sure. Um, you can do you can rinse with oil like coconut oil or olive oil as well. Try that. But salt water is the cheapest way for sure.
Okay, wait. I've never heard. Okay, so you can rinse with olive oil or coconut oil, like as in like just
Yeah.
put.
So let's say instead of the salt water, you can do like a tablespoon or two of coconut oil or olive oil. You rinse in the mouth for 5 minutes, 5 to 10 minutes, and then you spit it out. You know, so that's good for your gum, good for uh, yeah sensitivity as well.
Wow,
But most people they use salt water because it's easier, cheapest.
it's probably tastes better than the
Tastes
other
better
oil.
too. Yes, yes,
But you know
yes.
what? If it's olive oil is actually good for you. So you, if you use olive oil, you might as well just swallow it. Why spit it out?
Oh no, because so let's say you rinse for 5 minutes, and then you get rid of these bacteria in the it will pull out a bunch of bacteria from your teeth and your gum into this oil in your mouth.
Oh,
You don't want to swallow that.
okay.
You spit it out.
Okay. I didn't
Yeah.
know that.
So
Okay.
that's like a lot of bad stuff in that oil, so you spit it out.
Oh,
So yeah, some people do this rinsing at night, but I think the correct way is you do it in the morning when you wake up first thing in the morning, and then you rinse for maybe 5 minutes, 10 minutes, and then you spit it out, and then you brush, and then you go on with your day.
oh.
Or you can do it at night, but I think the most effective way probably is in the morning, first thing in the morning when you wake up.
Hmm.
Otherwise, just do a salt water a few times a day whenever you feel like you need
Right.
it. Yeah,
Salt water is cheapest as well, and it
yeah,
probably tastes
easy.
best.
Yeah.
Okay. I think I pretty much covered everything. But you know what? Today I'm going to ask you one more question about something else because, first of all, I know that not a lot of people, maybe they may not know about Vipassana meditation, but the most grateful thing, I mean, you've done a lot for the family, but for me personally, the biggest gift that you gave me has been Vipassana because you're the one who tried that first, and then you introduced it to everybody else in our family. um, Maybe share a little bit about like our body. We have the body health that we try to take care of. The body we take care of our body, brushing our teeth, rinsing our body, and showering, and taking care of our physical body. But on our mind, man, I think if anyone should try something, maybe it will, they may not have the same benefit as I did or as you did, but at least I think that it's something that they should try out. You want to talk a little bit about Vipassana?
Sure. Vipassana, where it comes from the Buddha, right? But sometimes it's become religiously, promoted somehow. But we should make it a s- a mental training, basically. It's a mental training, just like a physical training. The mind needs training to be calm and stuff. So Vipassana is a way to make the mind calmer, less reactive, and it's a lifetime job. It's a lifetime. training. So just like when you exercise, you do every day for the rest of your life. You don't just do for a few years and then you say, that's enough. No, no. So same thing. Vipassana is just a way of life. You do every day, however long you can afford, and basically you need to take a course to know the technique, and then you apply it. Sometimes you do it the wrong way, even though you take the course. So if you need to retake it, then by all means, once a year, maybe take the course again to refresh. Make sure you're not doing it the right way. It's easy to do it the wrong way.
Yeah.
It's so simple to describe, but it's so much harder to really practice.
Yeah.
Yeah, it's so delicate,
Yeah.
so easy to go wrong, and not knowing. That's the danger.
That's right.
Yeah, you can.
Unknowingly, yes.
Yeah, you can stray, and then you don't know. So yeah.
What kind of
uh,
benefits did you get with Vipassana?
well, you get for me, I have a much better perspective in life. I it changed my life. The trajectory of my life was completely changed. For me, it becomes much more simple.
Mm.
So without Vipassana, I would have been with a few kids for sure. But then yeah, right after the first course, I saw no need right away. I didn't see any need for having kids, and then it right away it shaped the direction of my life. Yeah, yeah. So for each person it's different, but for me it's the the way you see life. It's so different after the just the first course. Somehow it just totally changed me.
You know what? My brother has always been a simple guy. The only for me personally, I felt Vipassana was it made everything make sense about how things are in life. When unwanted things happen, how I deal with it. And then when wanted things that I want to happen, it doesn't happen, how I deal with that. So that helped me a lot. And also with the relationships that we have in our lives, that helps a lot for me as well.
Yeah. Well, you become less attached, you know, to things, right? To people and to things. You become everything is much less. Um, it it doesn't weigh you down, as much.
Yeah,
Less attachment is
yeah.
you feel more easy, more what should I say? Easy to move on and to yeah.
It put everything into perspective as what is important and what is not. Yeah.
Yeah, for sure. Yeah.
And you know what? For this talk here, if you got some benefit on the dental care, great. But if none of this is new to you, if all of this is I know that already, then maybe Vipassana is the thing that you needed to hear in this interview. So I'll put a link in our website and let you know how you can try for Vipassana, because number one, it's free. It's 10 days. It's a big commitment of time. It's free, it doesn't cost you anything, but it does cost you 10 days. However, it might be the single tool that will help you the rest of your life. So I highly recommend that, and I'll put it in the information of our interview. Thank you so much for being on this show. Um, you've always been a quiet force, like a rock in our family. And even your personality, you're not the hyper type like me. You've always been the rock, like very steady, very firm, very stable. And thank you for that. And I know that when it comes to dentistry, that helps a lot too, because you've been known to be a very gentle dentist. So thank you for everything that you are to me, and for those that you serve, and also here on this interview. Thank you so much, Gojan. Thank you, and we'll see you next time.
Thank you for having me. Yeah, thanks.
And for those of you who are watching in, thank you for following, and I'll see you in the next episode.
Bye.